2.
All right, hello everybody. It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. And this is the time I get to spend with you guys answering all of your plastic surgery questions. And today it's special for a few reasons, but reason number one, it's the last Hump Day of the year. That's right, the last Hump Day of 2024. It's been an absolutely tremendous year, and today, as I always do, I know some of you have been following me for many years now, as I always do on the last Hump Day of the year, I talk about our BBL stats, all right? As far as I know, nobody else does this. We are completely open and upfront with all of our BBL stats. We do this at the end of every year. It's always the last Hump Day of the year. If you want to look at our stats from years in the past, just scroll down our Instagram and you're going to find it there, or you can go to YouTube at Pure Plastic Surgery and you can find it on our YouTube channel. And you look at our stats from years in the past, okay? But today I'm excited to present to you our BBL stats for 2024. But before I get into that, just a special reminder, as it snows here, right? When it's snowing, what does that mean? It means it's almost the end of the year. And what does that mean? It means that prices are going up. Yes, prices are going up in January in 2025, as they have done for the past several years. So some of you have been following for a while know that as well. So if you want to lock in the lowest rates that you're going to get for all of, before 2025, it's time to lock in right now. So you have basically a couple weeks to get the best pricing that you'll get at Pure Plastic Surgery before everything kind of picks up in 2025. And I'm not just talking about myself, I'm talking about across the board for Dr. Vidal and Dr. Wigriff as well. So I highly encourage you to book now, because why pay more later? And of course, the quotes are good for a year, and they are no risk, because they're all 100% refundable up to within 45 days of surgery. So little to no risk, only upside. Now's the time to book. Why pay more later? That makes no sense. All right. Okay, let's get into these stats. All right. So once again, we compare our BBL stats with the rest of the nation. And after we get through this here today, you're going to very easily see why we are considered a BBL and BBL Safety Center of Excellence. Okay? Because our numbers are much better than the national average, okay? So, first of all, are we basing this on like 2 BBLs, 5 BBLs? Absolutely not. We're basing this on hundreds of BBLs that were done here at Pure. And so in 2024, we performed a total of 370 BBLs here at Pure. Like if we did one a day, it'd be like a BBL a day, right? There's 365 days in a year. So it's like BBL a day keeps the doctor away, right? All right, so we did 307 BBLs. I did about 73% of them, so about 270 that I performed myself. And then Dr. Vidal did about 21% of them, and Dr. Wigger performed about 6% of them, okay? So that's our breakdown. That's what the numbers that we're basing all of this on. And we're basing this against the national average, which are numbers that anyone can find if you go and you research them, because this is based on published studies, okay? These are based on national publications in the Aesthetic Journal and in the Journal of Plastic and Reconstructive Surgery, or PRS, okay? So, what does the national average say that their fat retention rates are? It says that their fat retention rate is about 50%. Well, we do better than that here at Pure. Our fat retention rate is 70%, okay? And now I'm talking here overall retention. I'm talking overall retention between buttock and hips. All right, so the hips always tend to lose a little bit more than the buttock, but putting it all together, we have a great retention rate of about 70%. I tell our patients that you can expect to lose about 30%, which you probably do in the first 3 months. That's why it is so important to feed the fat for the first 3 months, okay? I don't want anyone losing any weight. Don't lose any weight whatsoever for the first 3 months, okay? Because that's how we can maintain this higher fat retention rate. And so we're on top of our patients, and of course you guys are highly educated because we educate you all the time. And I think that has a great deal to do with that, because we talk about feeding the fat and how important it is. And so I think that's what helps our retention rate as well as the fact that we don't do, we don't like do like a lot of like different processes to the fat. We like to keep it as natural as possible. All we do is add antibiotics to it, which we'll talk about down here, and that's it. And then we place that fat back in, and so we don't do like centrifuging and all these other things, which I think could potentially affect the fat survival. And so for all those reasons, I think we have a pretty good fat retention rate, and it's better than national average. Okay. All right. So that's the next big question, right? Revision rates. Everyone talks about revisions, right? Well, overall, the revision rate for BBL tends to be higher than any other surgery. Why? Because there's a lot of factors that the surgeon can't control, right? We can't control, for example, the quality of the skin. We can't control the quality of the fat. We can't control how well the patient does their post-op care with their compression and their massages. We can't control the patient is feeding the fat. All these factors play a role, and many of them are outside of the surgeon's control. And so there is a revision rate for BBL, but what I can tell you is that the national average revision rate is somewhere between 10 and 15%, and that the revision rate here at Pure for this year, it actually improved by a whole percentage point. So I'm really happy about that, really proud about that. Our revision rate dropped to 5%, only 5%. Last year was 6%. This year is 5%. So that's it's 1/3 to 1/2 less than the national average. I think that's pretty incredible. I think a lot of that has to do with our technique, but a lot of it has to do also with patient education, and so the patient's understanding what are realistic expectations and what are not. Okay, so overall a fairly low revision or refinement rate, and we're pretty happy about that. Okay, however, that is different than a round 2. So a revision or refinement is kind of wanting to improve something that was done initially. Not necessarily a thing that was done wrong by the surgeon or the patient, but just, areas that we want to focus on, that we want to fine tune, right? That's opposed to a round 2. A round 2 is when you want, like, say for example, if you didn't have enough fat the first round, you want to come back and just add more fat because you're looking for a more dramatic look, right? That's a round 2. Or say you wanted more volume, or you wanted more hips. That's a true round 2. Or sometimes patients, were a little bit higher in the BMI scale, and excuse me, a little bit higher in the BMI scale, and so they want more fat removal because here in Florida we have a max amount of fat that we can remove in one surgical setting, which is 4 liters, right? So sometimes patients come back to just have more fat removed because they're a little bit higher in the BMI scale. So that tends to be pretty stable throughout the board, throughout the US. It's about a 15% round 2, 15% here at Pure. Pretty stable throughout the board there. No changes there. Okay? Now this is one of the things that we are most proud of here at Pure, which is the infection rate. Now the infection rate for BBL usually is higher than, say, something like a breast augmentation. Why is that? Because we're dealing with fat and we're dealing with the buttock, right? And of course, if you're dealing with the buttock, you're very near that the perianal area. There's going to be bacteria and things that can add to the potential risk for infection. But here at Pure, this is something that I've been refining for years and years and years. And so we do several things to decrease the infection rate. Okay, so what are some of the examples? So we have all of our patients shower with Pivot starting a week before surgery. We then have them all use a cream for the nose called mupirocin to decrease the bacterial burden. Then on the day of surgery, we do give them some antibiotics in the IV. And then before we go to put the fat in, we re-prep the patient one more time. We are always re-prepping the cannula, the instrument that we use to place the fat with betadine. And we put some antibiotics in the fat before we transfer it. And one more thing, before all of that, before we even start the case, we use a special UV light. This is a trick that we learned from COVID. We use a special UV light to basically kill everything in the room, in the OR. Because as you know, UV light, as we learned from COVID, it not only kills bacteria, but it kills viruses as well. And so we use that UV light before we start any case. And so all of that combined plus the fact that we educate our patients and make sure they're taking antibiotics orally for a week after surgery. Look at this, guys. We've been able to decrease that infection rate to 1.3%. That is incredible and not seen almost anywhere else. It is due to all of the efforts that we put in to really minimize the risk of complications and minimize the risk of infection specifically. And this is what I'm talking about when I talk about we don't just talk the talk. We walk the walk, right? We go the extra mile for the patient. And so when you're like thinking about going to like a high volume center or whatnot, and you're like, oh, why are your prices so much higher? Because it's not about price, right? It's not about a number. It's about value. It's about the value that we bring. And part of that value is the patient experience. And part of that patient experience is making sure that our patients are safe and the complications are as low as they can get. Okay? So, look at this. Truly incredible. We have a 1.3% infection rate. Okay? Ultrasound use. Well, you guys know this is my thing, right? One of the pioneers in ultrasound use for BBL. One of the first ones to use it consistently. I've been using ultrasound for BBL since 2019. Since then, from then till now, I've done about 2,000 ultrasound guided BBLs, probably the most than anyone in the nation, okay? And we wrote a paper about this that was actually published this year, all right, in the Aesthetic Journal. And anyone can go and look that up. If you look up my last name or Dr. Vidal's last name, we published that paper in the Aesthetic Journal this year, which shows you our experience with ultrasound guided BBLs and how safe we are and all the value that we bring to the patients. And that we use the ultrasound for 100% of our cases. Now, if you're a surgeon in Florida, you should be using it for 100% of your cases as well, because now here it's the law. And they just passed that law recently in New York as well. So if you're a surgeon in New York, you should be using ultrasound for 100% of your BBL cases as well. However, it is not the law in every state, and it is not the law in every country. So here I just put it varies, right? It varies from state to state, varies from country to country. In my professional opinion, it should be used for all BBLs in any state, in any country, across the board. Ultrasound needs to be used for 100% of BBLs, okay? And thanks to a lot of the advocacy and the fact that, I spoke and presented for everything that we've done here, I think this is becoming more and more popular. And so thankfully, more and more people are using ultrasound. And as many of you know, I am the president of the World Association of Gluteal Surgeons. And so we have surgeons from all over the world, all over the states, and we all advocate the use of ultrasound for your BBLs, okay? It's almost like, it's a requirement to become a member, basically, okay? So again, yes, 100% of BBLs is done with ultrasound, which leads to, very directly, the next fact, okay? And the next fact is mortality regarding BBL, right? Everyone, the press still tries to make a big deal about it. They still say things like it's the most dangerous cosmetic surgery procedure out there. And this is what I have to say. That information is incomplete, because it can be dangerous if it's done in the wrong hands by someone with no experience who doesn't use ultrasound and doesn't care about the patient. And especially when you're like in a high volume budget type center. So yeah, if it's not done correctly, it can be dangerous. But this is what I want to tell you. When it's done correctly, okay, it can be very, very safe. Okay, and that's when it's done by someone with a lot of experience, who has over 2,000 of these BBLs under his belt, who uses ultrasound 100% of the time, okay, who has patient safety as the #1 priority, all right? It's not just about volume, treating patients like a number. That's not the way we work here at Pure, okay? So, our mortality rate for BBL is 0. 0, okay? It has been 0, it's always been 0, and it's still 0. All right? So, why is that? Because of everything here, right? We use the ultrasound 100% of the time. We focus on patient safety. We don't just talk the talk, we walk the walk. We are certified by the Joint Commission, right? We have the highest level of certification that you can obtain for an office-based surgery setting, okay? So, as you know, the office surgeries, they can be certified by the Department of Health, which is kind of the baseline level. You need that in order to operate. So you need the Department of Health. And then you have something like that's Quad A, which is a bit of a higher level. And then the highest level that can be achieved is what's called the Joint Commission, or JCO. And that's what we have here at Pure. Okay? All right. So, very proud of our stats this year once again. Yes. I want to say, not only that, this is definitely not about me, it's about our team. So I just want to say here on the live that I'm extremely proud of our team. We've worked hard year round to make sure that our patients are well taken care of and that we're providing value to the patient and creating these beautiful and unforgettable patient experiences. And of course, I'm very proud of my partners, Dr. Vidal and Dr. Wigriff, who are doing absolutely great, beautiful, beautiful surgeries and growing year on year. Okay? So, having said all that, I'm happy to take some questions.
You're in trouble.
Oh.
A lot of questions.
Oh, good.
Yes. First of all, Doc, where are we located?
So, we are in Miami. So, the name of the practice, as you see here, is Pure Plastic Surgery. We are in Miami, and I invite you to go to our website, beautiful website. Go to www.pureplasticsurgery.com. And you can look at our gallery, and if you want to have an evaluation, we can do a virtual consultation right there on the website as well. And that's why we take patients from all over the United States and international. We have patients from Canada, Europe, as far as Australia. People come from all over the world here at Pure.
Okay, I'm 34 and looking to get pregnant in 2025.
Okay.
Also lost 110 pounds and
Ooh.
want a tummy tuck. Should I wait?
Yeah, I mean, for a tummy tuck, I would say, especially if you're, like you say, you're like actively looking to get pregnant, it's probably going to be best both for your weight to first stabilize and then to go through your pregnancy. And then once you've gone at least 6 months after giving birth, then we can consider the tummy tuck at that time.
Okay, this is another case on TikTok and it's similar, but she had a gastric bypass 3 years ago. She lost 165 pounds.
Great, congratulations.
But loved to have a BBL.
Okay.
So a year ago, she can have surgery now?
So I mean, the short answer is yes, especially if your weight has stabilized. But I want to make sure that a BBL is kind of your best, like the best first step for you. Okay? Because if you lost that much weight, it's very, very likely that you have quite a bit of loose skin. And so if you have loose skin, I always recommend do your tummy tuck first. Okay? So do your tummy tuck first. All right, get rid of the loose skin, tighten up the muscles, make everything nice and tight, and then come back. You can come back 3 to 4 months later and do your BBL.
Okay, Doc. Well, before the next questions, the most popular answer about the favorite Christmas movie that you left this morning.
Yeah, what was that?
You want to guess or?
Love Actually.
No.
No?
No.
Grinch. Yes.
He's the winner. Like 70%, the Grinch.
Okay.
Okay, let's keep with... A ver. Okay, Doc, we keep here. Do you guys do awake lipo plus BBL?
So we don't here at Pure, okay? All of my cases, especially the bigger cases, are all done under general anesthesia, especially liposculpture 360 and lipo BBL. I actually believe it is safer that way because we have great anesthetists here. And so the risk for the general anesthesia is very, very low. And so why do I think it's safer? Well, because when you're doing awake lipo or BBL, you have to inject something to numb the patient, which is what's called lidocaine. Now this lidocaine, you can only give so much to a person. If you go overboard, you're gonna get what's called lidocaine toxicity, and that can lead to like neurological issues such as seizures or heart problems such as heart attack. Okay, and I just want to avoid that risk altogether. So when I do it under general anesthesia, I use zero lidocaine, so there's 0% chance of a lidocaine toxicity.
Um, can you get a breast lift augmentation with keloid skin?
Can you get it? Sure, you can, but we have to make sure that we're on top of that skin, right? So typically when I do a breast lift with implant, for most patients, I will be doing what's called an anchor type pattern. And so there are going to be several incisions there that we got to stay on top of. So what does that mean? Well, starting at 2 weeks post-op, we're going to be using a scar cream called Silogen, which is silicone based. And you're going to be very, very diligent with that. You're going to be using it twice a day, every single day for the first 3 months, okay? Now, if we see the scars start to get a little bit raised, then the next thing we're going to do is we're probably going to inject the area with a steroid called Kenolog. And typically, if we're massaging, if we're using the Silogen and Kenolog as needed, we can kind of keep the keloids at bay.
So, what's the difference between Lipo 360 and a BBL?
Great question. So there isn't really a difference. So let me put it this way. A BBL includes Lipo 360. Okay? So a BBL is Lipo 360 plus fat transfer to the buttock and hips. And people they just shorten it, right? They just say BBL. When they say BBL, they mean liposculpture 360 plus fat transfer to the buttock and hips. So Lipo 360 alone, there's no fat transfer, and BBL is Lipo 360 plus the fat transfer.
Okay, Doc, do you review the virtual consultations?
Yes, we review all the virtual consultations. By we, I mean the different surgeons, okay? And so we look at your questionnaire, we look at whatever history you put on there, we look at the photos, we make our recommendations, we let your coordinator know what our recommendation is, and so then they contact you. There's 3 ways to have a consultation here at Pure, okay? The fastest, easiest, most efficient way of doing it is with a virtual consultation, which you do straight off the website. So you go to www.pureplasticsurgery.com, you're going to find a little icon there that says start your journey or virtual consultation. You hit that, you fill out the information, you send your photos, we'll take a look at that. One of the surgeons, with the surgeon of your choosing will make a recommendation, and then our coordinator will get back to you. That's 0 cost. Now, if you want with me a video consult, that can be done. It can be, we can make an appointment for that, but that's going to have a cost of $250. And if you're going to want a consult in person, then again, it can be done, but it has going to have a cost of $500. Now remember, these costs go towards your surgery, so you're not losing that money. It goes towards the surgery.
But if they ask for a picture, there's an extra charge.
For a picture?
Yeah, for the photographer. For really.
Oh, really? Oh, boy. You don't need one.
Okay, how long do you have to stop smoking prior to breast surgery?
30 days, okay? There can be no nicotine in your system at all at the time of surgery. So 30 days before surgery, you gotta stop all nicotine. So by any means, whether it's smoking, vaping, nicotine gum, etc. No nicotine at all in your system. So you gotta stop all nicotine 30 days before surgery.
Can you get a tummy tuck, bra back lift, and arm lift at the same time?
We typically don't do all of that at the same time. What we do, what's very common, the trifecta perfecta, what we do very commonly as 3 procedures is your tummy tuck with your breast lift plus or minus implants and your arm lift. That can all be done at the same time because everything is done in the front. Usually the back lift is something that we stage and we do later.
Okay. Boom, boom, boom. Can you follow up with spot radiation after surgery for keloid skin? Oh, this is a recommendation from another patient.
Yes, you certainly can. That's typically something that you can look into. A lot of times, sometimes it can be done through your insurance. The only thing I would say is make sure that you're fully healed right before you radiate the area.
Okay, esta es en español.
Okay.
Tengo flacidez abdominal,
Bien.
celulitis en los glúteos,
Okay.
quiero un levantamiento de senos. ¿Qué
Ok.
debería hacer primero?
Perfecto. Es más, lo puedes hacer todo al mismo tiempo. Si tienes la flacidez abdominal, la recomendación ahí va a ser un tummy tuck. y los senos, bueno, vamos a hacer el levantamiento. Y al mismo tiempo podemos usar un aparato que se llama Abeli para la celulitis, ¿ok? Y todo eso se podría hacer en la misma cirugía. Puedes hacer lo que le decimos un mommy makeover, que es la combinación del tummy tuck con la cirugía de seno, plus el Abeli al mismo tiempo.
Okay, so can I have a breast lift and arm lipo at the same time?
Yes, for sure. So that's definitely something that we can combine. We can do the breast lift with or without implants, and if you wanted to add arm lipo or even body tight to the arms, it could be done at that time as well.
Okay, what if I get a tummy tuck first? Then I don't have enough fat for a BBL.
That is an absolute myth that I have never seen in my career of 12 years as a plastic surgeon in thousands of cases. Okay? It is a myth. So I know people say that. They say, well, if I get my tummy tuck first, I'm not going to have enough fat. But that's just not true, right? When you do a tummy tuck, number one, when you do a tummy tuck, we're not lipoing the central belly area. At least I don't, because I want to prevent any potential problems with the skin. I don't want the skin dying or wounds opening up or any issues. So none of this fat here has been touched. We do touch some of the fat here in the flank and the waist area to start contouring the body. But again, none of the fat in the back has been touched at all either. And then that's not even to say that if you have some excess fat in the thighs and the arms and everywhere else. And so there's plenty of fat to get for your BBL. So I've never had a problem of not having enough fat after a tummy tuck. What I have had the problem is when people do it the opposite. When people do a BBL first, then the tummy tuck after, that tummy tuck becomes a lot more challenging and quite honestly, more risky. Even just today, I had someone did a tummy tuck and someone had a BBL first, and the skin was scarred down. It was very tough to like pull it to remove, as much skin as I wanted to. There were like seromas and scar tissue underneath there. And so it just becomes a very challenging surgery. You don't get to remove as much skin as you would like because the skin just doesn't stretch, and it's just and then you have to worry about the blood supply as well. So my recommendation is always do your tummy tuck first. Okay? Get rid of that loose skin, make things nice and tight so that the lipo afterwards becomes a lot easier, a lot smoother for you. Fix that muscle repair, get all that done, and then come back for either your lipo 360 and or BBL.
Okay, last question that's very important.
Okay.
How do you minimize the risk of fat embolism or other serious complications?
That's right. So I'm not sure if you were here for the entire talk, but that is what today's all about, and that's what I really want all of you to take home, right? So social media, the press, they still have outdated data, right? And they all try to scare you and say that the BBL is a dangerous procedure, it's the most dangerous procedure out there, that there's a risk of fat embolism and sudden death, right? Okay, that data, what they're telling you is incomplete. Number one, the data is outdated. That mortality rate of 1 in 3,000 was back in 2017. It's not the mortality rate for BBL today. The mortality rate for BBL today, in general, on the last published data is about 1 in 15,000, which is very similar to a tummy tuck, okay? But we here at Pure Plastic Surgery, we go the extra mile, right? We don't just talk the talk, we walk the walk. And so we do several things to make sure that we minimize that risk of fat embolism to, as close to zero as possible. All right? Things are never actually zero in medicine because nothing is zero in life or in medicine. But as close to zero as possible. So what do? We use ultrasound guidance for our fat transfer 100% of the time. Not only that, but we've been doing it for a while, and so we have a ton of experience. Like I said, I've been doing ultrasound guided safe BBLs since 2019. I have over 2,000 safe BBLs ultrasound guided under my belt. Okay, and I've never had an incidence of fat embolism or death, okay? Because we go that extra mile, we keep the patients safe, and that is the value that we bring to our patients, okay? All right, everybody. Well, it's just been an awesome year. I want to thank you guys, all of you that have been listening to our Hump Day Lives for years maybe, or this entire 2024. As you know, we're here every single Wednesday, or most Wednesdays, And we go over plastic surgery topics, answer all your questions. So I look forward to hanging out with you guys in 2025. I want to wish all of you happy holidays, Merry Christmas, Happy New Year, okay? And we'll catch back up in January 2025. And before there, remember to book because prices are going to go up in January, all right? So book now. I'll see you then. Take care. Ciao.